Thank you so much. I think these have been really interesting presentations. My question is actually mainly related to the aspect that we haven't really talked about, and I think research and evidence was one of the things which we were told in the morning is an important component of public-private partnership. And that is really, we've talked about the labor problems, the living condition problems, the health problems, but what about the economic loss? It was alluded to, and I remember Lorna especially said, like, productivity loss is about, like, productivity gain is 8 times if people know that they are covered by their health insurance. So this would be an area, I think, which is very important in terms of bringing out, like, the supply chains kind of thing. What happens to a big firm when when the supplies that they have, the people who are going to say, let me just take an example from India. A person, a textile manufacturer, he gives out clothes to be woven. He gives out clothes to be embroidered. There are tons of things. Those don't come back to him. He's not able to supply it to his exporter. Now this whole chain actually breaks down somewhere, and then it's a loss to the entire chain or to the, and it's an economic loss to the country. So what I'm trying to say here is, a very big partner in this whole thing should be Ministry of Finance, who should realize that what is the GDP loss to them if they were actually not investing in the health of the informal sector workers. In India, 50% of contribution to GDP comes from informal sector workers. And if they are not cared for their health, and the Oriel just brought out in her presentation, these informal sector workers are increasing. And also Martha mentioned in the morning, like, those who are providing services are actually, the unorganized sector may be declining, but the informal sector, the informal workers are increasing. And that's a big problem, which I think one needs to think about. Thank you.
Thank you. So many of you here are familiar with the Commission on the Macroeconomics of Health. But that did not focus specifically on the informal workers sector. That would be a very interesting sequel to that. I've got a couple of hands, and I saw the one in the back, but let's first go here.
Thank you. I'm Cheryl Christensen with Procter & Gamble, so I'm one of those corporate types, but I haven't always been. I have experience with the military, with the government, with academics and in private practice, but I have been with a corporation for 25 years, and I must say, thank you for all your comments. I have to agree with everything that's been said. It is very complex, and I know that we are here because we want to be part of the partnership. And I would just comment quickly, internal facing work. I heard the last comments being, corporations being accountable and responsible for the health of their employees, and we've done a lot of things to try and figure out how to help our employees think about their health and understand that ultimately, in the still of the night, it's their choices. Many of our employees are lucky enough to have basic health and needs met. I know in many countries that is not the case, but trying to think about that, and the way we went after it in the 80-plus countries we're in was developing a global, solid framework with tools and education and training. A global framework and global branding with all the tools and training behind it online to make it easy. As we deployed it out to these 130,000 folks, though we realized all the cultural differences coming to play and language, etc. And so we asked them to make it locally relevant to them, to do a local health needs assessment, not only in their communities in which they live and work, but also with themselves as individuals. And so that was our idea. We came from 10 years ago doing traditional occupational health around the world, and we saw this need. So it's a journey for us. We're far from getting it perfect or getting it right. We're trying to measure as we go. So that's how we're thinking about it internally. And not only do we want physical health, but of course we know for true engagement, which is what we'd love to have every day and be excited about work, that we've got to get better at managing stress, because there's not less of it, as we all know, and hopefully move toward resilience. So that's what our thinking tank folks are trying to help us with. Externally facing, you know, we're a company. We make products. If we don't have consumers that are willing and able and interested in purchasing, then, as Marlee said, we don't have a business. You know, so there's something about the sustainability of the whole idea around the world of making this work. You know, we're interested and we're here because of we have a safe drinking water initiative. We're trying to partner with as many people as we can. We want to continue to educate our young mothers and our young women so that they're able to carry on both with motherhood and with getting through school so they can be productive. So I just wanted to share that our approach has been trying to help our employees and our consumers see what is important to them, because we know that only when it's important to them are they likely to take the work and effort to go about making change, because it's hard. So that's it. Thanks.
Thank you. And picking up on that briefly before we go to the next and one of the last comments. As
And
Derek,
David, I would also at some point
Yes.
like to respond to some of the comments that I've.
we'll get you.
Okay.
As Derek brought to our attention, and Victor before he had to leave, in the environmental space, quite a few major corporations have made some big commitments to partner together, to take big steps, and to share information, to hold themselves accountable, and so on. Is that possible in this space? We won't have time to. I'm hoping the answer to that is yes. The informal workers and health, is that something that we could imagine? And if so, what kind of effort would it take to get that underway? But we're running out of time now, so let's go on to our next comment. Yes.
Yes, thank you. I'd like to go back and reference some of the excellent presentation work from the industry members. And I think Dr. Zhao's comments a little bit earlier around metrics and looking at performance of industry in terms of supporting UHC or global health efforts. It's not really a question. I just bring up the fact that there are precedents out there that can be used. As an example, some of you are probably familiar with the Access to Medicines Index, in which the top 20 R&D-based pharma companies are ranked every year on 7 very straightforward metrics. So it's simple, but it's very powerful. And it addresses performance around affordability, access, and availability of products, especially to poorly resourced countries. So I'm just saying that there's things out there that we can borrow from already that exist that we might be able to expand on to different sectors to help address the metrics piece of this. Thank you.
Thank you. We have 3 more, and unfortunately then we will run out of time, starting with Elaine, and then you moved up, all right, and then Marlies.
Yes, thank you. I'm from PATH. And so I would echo what my colleague Kim here says, is that we should also pay attention to what FSG and the Shared Value Initiative is doing. They've done a lot of work around that, and particularly around how we can get the analysts to think differently about how we need to report. If we start with the financial sector and the reporting, we might see a real sea change. So my comment really, apart from a slightly cheeky one on Lorna's presentation, which is that PATH is actually working with BHP Billiton, talking to Anglo American, has worked with Chevron. So perhaps if there's a correlation there between great case studies and PATH's work, I'll submit that for your consideration. One thing we haven't talked a great deal about in this context is the actual desire to perhaps make a market for the pharmaceutical organizations. And certainly as some of them have come to PATH, it is very much about understanding the landscape at the bottom of the pyramid and looking for ways to take their products and their brand into that space. And I'm relatively new to this sector. I'm from the private sector. And I understand that there's a lot of controversy around that, and certainly probably plenty of opinions around this table on that. But I think health of a workforce and productivity is one area, but then the desire to have a public-private, or maybe just an NGO-private partnership around developing access and creating more of an effective market is one that we should certainly consider.
Yes, go ahead.
Thank you very much, Julieta Rodriguez Guzman. I'm the Regional Advisor on Workers' Health for the Pan American Health Organization. I wanted to make two questions, in fact. One to the employee presenters that made such provocative presentations. And I say provocative because from the public health point of view, we would really want all those optimistic proposals to come into action. So the question is, how? Simple, how? And then I want to make a question to Noriel. Oriel, ¿cómo estás? You mentioned that for the metrics and the indicators, you're using survey analysis and data survey available. Can you speak a little bit in depth on that? Because this would be the basis for strong indicators or weak indicators. Thank you.
Yael, can you do that pretty quickly?
Yeah, sure. Yeah, very quickly. Yeah, we review the survey available in the region about the household surveys to try to identify the strong indicator for informality. And we try to use the ILO model to try not only for the ECLA, but also we try to identify some of them in the country that are not available. We review not the report of them, we review the questionnaire and the item they use to try to see if we come to comparative between the country and to try to see the trend. At the same time, we review the service of health and something for the health and social protection in some of the countries that we have. And we try to identify item on information available about health outcome, about access to health care in relation for animal health needs, and at the same time the health coverage relation for enrollment on another mechanism that the people describe, no? And we try to identify in this survey some indicator for the informal worker or some proxy to try to measure informal worker. And this is to try to put together to try to see the real picture that had happened. And this is the process that we are doing now. We review all the surveys in the region. We have some platform online on all the questionnaire and the item that we have to comparative of them. And we need to review the quality of them to try to then, we have to analyze it more detailed, the indicator, no? And also we include another indicator, something to analysis inequality, also ask for the occupational health service access, and also illness and injuries relation for occupational disease. But this is very specific in a few surveys available, not in the more frequently.
Thank you, Ariel. Marlies, the last comment.
Yes. On the, Derek, I think you and Victor touched on something that could be very important for workers around the world. Occupational health professionals and corporations have long admired the success that our safety peers have had with their initiatives. And we believe that the work that we do in protecting the health of the workforce and their families is equally as important. But we have struggled to have the enduring support that our safety peers have. And perhaps what is lacking is this issue of transparency and sharing of information around the actual health status of the workforce. So that's something that I think could be very powerful in making sure that companies really stay committed to the issue of health during both economic good and treacherous times. We've also talked about the fact that there is a great divide between talking about the formal workforce and the programs that we offer to their families and the informal sector. I think the only way to really get there is for communities and governments in the places where businesses operate to demand that companies that do business there devote some of their resources, and you offered an example of that. Because it is true, companies tend to think about the workers primarily, and then their families and the initial communities that are around them. So it's not something that may be intuitive to them to focus on the informal sector. It's going to have to come from the local communities to say, we need you to play in this space and to support not just the people that work for you, but the extended fabric in this country or community.
And as we close this session, just a few questions to hand off to the next sessions on the matter of getting from what is to what should be. Who should do what? So, question to WeGo and others: if we had informal workers in the room and asked them what would be most important to you to be done, who should do what? What would the answers be? Have we ever done that? Should we do that? Likewise, picking up on the comments and discussion we've had about what the global corporate sector can do. Can we imagine mobilizing, as Marlise was just indicating, to the point where big commitments would be made and followed through, as we see in the environmental side? And as we think about what the global corporate sector can do, what the governments, national and subnational, is a very important distinction, and what international organizations can do, how much can we count on for achieving how much? Because the attention needs to go to where the payoff is largest, not to where there's the most discussion. So that's for the next session. I'm sure they will answer all of those questions. Thank you. Join me in thanking the panel. Thank you very much.